of the General Assembly. I hope the entire delegates are present. The General Assembly is one of the six principal organs of the United Nations, serving as the main deliberative, policy-making and representative organ of the UN. The General Assembly is responsible for the UN budget, appointing the non-permanent members to the Security Council, appointing the Secretary General of the United Nations, making recommendations through resolutions and receiving reports from the other parts of the UN system. The General Assembly meets under its President or the UN Secretary General in the annual sessions at the UN headquarters in New York City. So let's move on to the topic. Well, delegates, we have all assembled here to work on the agenda which concerns the discussion of current COVID-19 status in all the nations. A lot of delegates are present here to talk about the subject, especially the delegate of India, the delegate of Brazil, the delegate of USA, the delegate of Italy, the delegate of Egypt, and the delegate of Australia. 10 months since we first heard of COVID-19, the pandemic has claimed more than 1 million lives and infected more than 30 million people in 190 countries. The infection is rising and there are troubling signs of new waves. The death rate is also increasing day by day. USA is the most COVID-19 infected country and the country where the death rate is at the topmost level. Due to COVID-19 situation, economy as well as education is going down. The COVID-19 has affected educational systems worldwide, leading to near total closures of schools, universities and colleges. Most governments around the world have temporarily closed the educational institutions in an attempt to reduce the spread of COVID-19. Approximately 1.077 billion learners are currently affected due to school closures in response to the pandemic. 53 countries are currently implementing nationwide closures and 27 are implementing local closures impacting about 61.6% of world's student population. 72 countries' schools are currently open. School closures impact not only students but have far-reaching economic and societal consequences. School closures in response to the pandemic have shed light on various social and economic issues, including students' debt, digital learning, food insecurity, and homelessness, as well as access to childcare, healthcare, housing, internet, and disability services. The impact was more severe for disadvantaged children and their families, causing interrupted learning, compromised nutrition, childcare problems, and consequent economic costs to families who could not work. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to the public health, food system, and the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty. While the number of undernourished people currently estimated at nearly 690 million could increase by up to 130 million by the end of the year. Millions of enterprises face an existential threat. Nearly half of the world's 3.3 billion global workforce are at the risk of losing their livelihoods. The list of impact of COVID-19 is a lot more. We are supposed to find a solution for this. The COVID-19 started in China, moved to Europe, then to North America, and then to South America, Africa, and India, and now to the whole of the world. And some people are now talking about second waves coming at any moment. Yet, there is total lack of international coordination in tackling the COVID-19 pandemic, and the go-it-alone policy of many countries will not defeat the coronavirus. What needs to be done is to make countries understand that by acting in isolation, they are creating the situation that is getting out of control, and the global coordination is the key. COVID-19 is menacing the whole of the humanity, and so the whole of the humanity must fight back. Individual country responses are not going to be enough. A global approach is the only way to fight COVID-19. I'm not extending a lot. You, the delegates, are present here to talk about the current COVID-19 status and educational status in your countries and how you are fighting it and what are the solutions. So, let me conclude here. Thank you.
Now, I invite the delegate of India to say about India's COVID-19 status and educational status.
Well, the present COVID-19 situation is that even though India is the second most populated country in the world, it is still underdeveloped because of overpopulation. We all know that overpopulation causes underdevelopment. So because of that, there are less hospitals to admit comparing to the number of sick people. At first, people were aware of COVID-19, but now it totally changed, and now COVID-19 is a common thing today. So, because of that, India is now one of the countries which have the major COVID-19 cases. And about reducing COVID-19 cases, the Indian government took many efforts to reduce COVID-19 cases, such as lockdowns, supplying of masks and sanitizers, etc. But even though this government is working really hard, the citizens are listening and unfortunately getting diseases and being spread to other ones. And about education, we have enough education systems in our country. But due to COVID-19, everything changed and kids now need to learn with smartphones or television. But there are some kids who don't have smartphones or televisions. Some kids, because of the depression of no knowledge to them, they hang themselves because of this depression. And about employment, you all know that India is officially low at employment. But due to COVID-19, the people who had jobs lost their jobs, and while some others are being banned employment because of family issues. The main people who had lost their jobs are mostly beginners and minor workers. The other thing is that the lack of doctors and nurses. Due to COVID-19, many doctors and nurses had to leave their hospital because they got the virus from their patients. Lack of doctors and nurses means lack of medical help, and lack of medical help means the death of the patients. And about the migrants is that if we search every part of the world, we can see that thousands of Indians are in other countries working for their families. But due to COVID-19, many people lost their jobs in the foreign countries and can't go to home because of the non-working of airports and stuff like that. Still today, many migrants are still stuck in the foreign countries and can't go to their home country.
I invite the delegate of Egypt to describe Egypt's COVID-19 and educational status.
Honorable President and delegates, as we are talking about the current COVID-19 spreading status of Egypt. COVID-19 risk in Egypt is kind of high and received warning level 3. CDC recommends travelers avoid all non-essential international travel to Egypt. Going into the COVID-19 pandemic, the Egyptian economy was already brittle than its apparent successful stabilization would suggest. The economic situation has since worsened as COVID-19 affected foreign capital flows and domestic consumption. While Egypt has the resources and international political and financial backing to overcome short-term bounds, the country presents serious fragility in the medium term of if there is no change, of course. Current confirmed cases of COVID-19 are 104,915. Recovered cases are 97,920 and deaths are 6,077. Fatality rate of total cases is 5.8% and recovery rate is 93.3%. COVID-19 measures taken by the Egypt. As of the end of April, Prime Minister Mustafa Batbuli stressed is 15 key governmental decrees that remain effective until the end of Ramadan or until further notice regarding fight against coronavirus. Article 1. A partial lockdown has been implemented in the country from 9 p.m. to 6 a.m. It is also applicable on transportation. Only case of emergency permit movement. Article 2. All cafes, cafeterias, casinos and clubs continue to be closed. This is also the case for nightlife service. Venues such as nightclubs and bars as well have to be closed. Food services industry remain operational as takeaway service until curfew hours. Article 3. All commercial and craft shops and providing services are closed. Commercial centers are restricted to working hours of 6 p.m. to 5 a.m. Article 4. All public and private mass transportation means stop from 9 p.m. until 6 a.m. Means are operational but must operate in a way as to avoid overcrowding of citizens. Article 6. All services provided by ministries and governorates to citizens, such as civil registry services, work permits, etc., are all suspended. The only functional ones are those of health offices. Article 7. Colleges, universities, and schools remain suspended. Article 8. Prime Minister's Resolution number 719 of 2020 continues to apply. Article 9. Article 1 to 8 are to be valid for a period of 15 days. Article 10. The suspension of international air traffic continues in all Egyptian airports until further notice. Article 11. As a violation to these taken decisions will result in a jail term or a fine not exceeding 4,000 EGP. Next, the topic effects on education after COVID-19. Ever since the COVID-19 virus hit Egypt, the Egyptian government has undertaken a number of strict measures to prevent the rapid spreadingness of disease. With approximately 20 million students enrolled in schools and universities across the country, the education sector has been one of the sectors that has been affected mostly by the pandemic. In March 2020, the Egyptian government decided to shut down all schools and universities and have all teaching undertaken virtually. The Egyptian Ministry of Education launched an online portal where all teaching materials was uploaded and where the students submit their work to be reviewed by teachers. On the other hand, the Ministry of Education ensured that all lectures were taught online and allowed each faculty to mandate the method of teaching. In conclusion, although e-learning has been introduced as a temporary solution, as such is likely going to remain part of the edu system even after the pandemic ends. Thank you. Have a nice day.
I invite the delegate of Australia to describe its COVID-19 and educational status.
Respected President and other delegates of different countries. Situation of Australian schools. COVID-19 was first confirmed in Australia in late January 2020. According to UNESCO, by the end of March 2020, over 1.5 billion pupils or 87% of the world's student population across 165 countries had been affected by school closures caused by COVID-19. In Australia, K-12 schools have experienced interruptions in every state and territory. Although the extent and period of closures have varied significantly across jurisdictions. In early May, only 3% of children in Victorian government schools were in attendance, whereas the Northern Territory had returned to normal levels of 79%. GP respiratory clinics. The Australian government is establishing GP or general practitioners respiratory clinics around the country to assess people with fever, cough, a sore throat or shortness of breath. Vaccines and treatments. Currently there are no approved vaccines or treatments to prevent or cure COVID-19. There are some treatments that can help people who are very seriously ill. Source of data. The department sources this data through contact tracing and management of the coronavirus or COVID-19 outbreak. Under the Public Health and Wellbeing Act 2009, the department is authorized by law to collect information from doctors and laboratories about diagnosis of certain health-related conditions in Victoria. The law exists to monitor and control the occurrence of infections, diseases and other medical conditions and helps to prevent further illness. The aim is to protect the health and safety of the community. On 29 January 2020, the Public Health and Well-being Regulations 2019 were amended to add novel coronavirus 2019 to the list of notifiable conditions in Schedule 3 and 5 requiring notification by medical practitioners and pathology services as soon as practicable. Australian Bureau of Statistics or ABS data is used to calculate a rate by population for postcodes and local government areas. Local government area population data is sourced from the Australian Bureau of Statistics or ABS estimated resident population or ERP for 2019. Postcode population data is sourced from the Australian Bureau of Statistics or ABS 2016 census figures. The ABS postcode areas can differ from the Australian postcode areas. The ABS postcode areas may not include newly added postcodes by Australian Post. Most affected areas in Australia. Other clusters of cases in and around Australia's two biggest cities are the Mornington Peninsula southeast of the Melbourne with 36 infections and Sydney's northern beaches with 68. NSW Central Coast, Woollahra and Central Sydney also feature in the top 5 most infected areas of the state. Victoria is also a most COVID affected area in Australia. All schools in Australia are open every day morning to evening. COVID cases are mostly very few in numbers in Australia. Only 1 or 2 areas are mostly affected there. Masks are not compulsory to go to outside in Australia, except some rare large famous companies or shops there. Thank you.
I invite the delegate of USA to say about the COVID-19 and educational status of USA.
Mr. President and delegates, the current spreading status of COVID-19 in America. The total COVID-19 USA cases crossed 140,000 as of 30 March, while deaths crossed to 2,400, making the USA the most affected among countries with coronavirus. The first coronavirus case in the USA was confirmed on 21st January 2020 in Washington in a person with a recent travel history to China. First coronavirus death in the USA was reported on February. Dr. Anthony Espausi, Director of the National Institute of Allergy and Infection Diseases, has warned that more than 2 lakh people could die from the disease. Human-to-human transmission has been reported too in the USA, which is concern. The first case of community spread in the US was reported on 27 February in Salon County in California. Community spread was also reported in Oregon and Washington. New York has reported the highest number of coronavirus cases and deaths in the US and also accounts for 40% of death in the country. COVID-19 measures in USA. The US government announced early measures to avoid imports of the infected, such as imposing travel restrictions, evacuating its citizens from the countries with coronavirus and approving coronavirus test kits, manufacturers such as General Motors and producing medical equipment such as ventilators. Let's look at the major measures of COVID-19 that took by USA. National-wide social distancing implemented. The US government imposed national-wide social distancing rules banning gathering of more than 10 people, avoiding public places such as restaurants and bars, and avoid non-essential travel. The social distancing rules were initially imposed for 15 days but later extended until April 30. Travel restrictions. The US started public health entry screening at key airports, which handled the majority of travelers from China on 17 January 2020. The first airport in the list include those at San Francisco, New York, and Los Angeles, followed by Atlanta and Chicago. US President signed a proclaimed on 31st January banning the entry of all individuals from China or those who have transisted through China 14 days prior to entry into the US. The ban did not include permanent residents and permanent visa owners, however. The government also assigned 11 designated airports for all flights carrying persons from China or those who have been to China. These airports are equipped with enhanced public health services to tackle the disease spread. Third one is evacuations from Diamond Princess cruise ship. The Diamond Princess cruise ship had more than 400 US citizens on board. The US government evacuated 338 citizens in 2 charter flights on 17 February. More than 100 citizens were on board the cruise ship. Some of who tested positive for the virus, they were isolated for 14 days before allowing into the US. Coronavirus testing in the US. The US passed a bill on 13 March making coronavirus tests for its residents. The CDS developed the PCR diagnostic pan for testing patient specimens for COVID-19. The test kit is used along with the applied biosystem 7500 folds real-time PCR instrument. Featuring SDS 1.4 software, it was approved for emergency use by the US Food and Drug Administrative under emergency USA authorities. Is affected to the education system of America. The coronavirus pandemic is the largest disruption of global education system in history. When the pandemic first hit, around 1.5 billion students around the world were sent home as schools closed their doors. Some have since reopened, but class is in session for to pursue their studies online. But for many, even in developed countries, that's not an opinion. The world was already struggling in grips with educational inequality. Now the USA warns the COVID-19 crisis is making it worse, disproportionately affecting the most vulnerable and threatening to the wipe out decades of progress for this generation and possibly beyond. Thank you.
Now, I invite the delegate of Italy to know about Italy's condition.
Dear President, in its early stages, the COVID-19 crisis looked nothing like a crisis in Italy. The initial state of emergency declarations were met by skepticism by both the public and many in the policy circles, even though several scientists had been warning of a potential for a catastrophe for weeks. Indeed, in late February, some Italian politicians engaged in public handshaking to make the point that the economy should not panic and stop because of the virus. A second lesson that can be drawn from the Italian experience is the importance of systematic approach and the perils of partial solutions. The Italian government dealt with the COVID-19 pandemic by issuing a series of decrees that gradually increased the restrictions in lockdown areas, which were then expanded until they ultimately applied to the entire country. In normal times, this approach would probably be considered prudent and perhaps even wise. In this situation, it backfired for 2 reasons. First, it was inconsistent with the rapid exponential spread of the virus. As a result, Italy followed the spread of virus rather than prevented it. Second, the selective approach might have inadvertently facilitated the spread of the virus. Consider the decision to initially lock down some region and not the others. However, 2 aspects of this crisis appear to be clear from the Italian experience. First, there is no time to waste given the exponential progression of the virus. Second, an effective approach towards COVID-19 will require a warlike mobilization both in terms of entity and economic resources. Italy is the epicenter for COVID-19 pandemic, with schools and universities closed at the end of February in the most affected areas of Italy and closed nationwide on March 9th. Almost 12 million of learners from the pre-primary to tertiary education are now at home. The country has since set distance learning as a rule to continue the fulfilling of constitutional right to education for all. The Ministry of Education immediately convened a task force for educational emergencies to meet the students' needs. The development of distance teaching practices, however, is much less straightforward for younger students. Challenges are more striking for the students under 6 years of age who cannot be kept in front of the computer for several hours a week. Despite being unprepared, they have reacted quickly. Some schools have activated or accelerated training opportunities for teachers. All these initiatives show that the Italian community, even in such a difficult and unpredictable moment, wants to find solutions. We are experiencing something unique. There will be lots of time to fully assess the effectiveness of these initiatives. But the sparks of innovation found in Italy should inspire other countries to find the energy to face up this crisis as well. Thank you, President.
Now, I invite the delegate of Brazil to say about Brazil's condition.
Mr. President of United General Assembly Volkan Bozkır, Mr. Secretary General of United Nations Antonio Guterres, Head of State, Government and Delegation, ladies and gentlemen, it is an honor to open this assembly together with representatives of sovereign nations at a point in time when the world needs the truth to overcome its challenges. COVID-19 has become the center of attention of this course of the year. And first of all, I wish to express my sorrow for each and every life lost. Presently, there are many cases every and each day. In Brazil, at the beginning of February, there was no such cases of COVID, but gradually it started to increase, which is taking place in every country. So on May, it was reached up to 3 lakh, and when August came, it was increased up to 34 lakh, and presently it has overcome 50 lakh. So we, the government of Brazil, are trying to tackle the spreading of COVID. COVID is also affected by the tribes of Amazon. They are using their non-medicinal plants and herbs in order to cure COVID in them. They are saying that it is very successful. If you are talking about the educational system of Brazil right now in this condition of COVID, it is changing to technologies. 47 million students are trying to adapt with the new routine of distance education. $400 million were allocated to the research, development and production of the Oxford vaccine in Brazil. May God help us to tackle this and change to the normal condition. By expressing my sorrow for each and every life lost, I conclude my words. Thank you.
We had heard from the last delegate of the UN General Assembly. I appreciate the work of the delegates for high-quality interventions that you have made during this assembly. The seriousness in which you have described the current COVID-19 status, educational status in your countries, how you are fighting against it, and what are the solutions that you have made. I really appreciate them all. Now, it is time to end the United Nations General Assembly. 10 months since we first heard about COVID-19, the pandemic has claimed more than 1 million lives and infected more than 30 million people in 190 countries. Infections are rising and there are troubling signs of new waves. Much about the virus is still unknown, but one basic fact is clear. The world was not prepared. The pandemic has revealed utterly inadequate health, yawning gaps in social protection, and major structural inequalities within and between the countries. Even though the government is working hard, the people are not listening and are unfortunately getting diseases. Coronavirus pandemic is the largest disruption of global education system in history. Education is one of the sectors that has been seriously affected by the pandemic. We are experiencing something very unique, and there is still tremendous uncertainty of what needs to be done. Development of distance teaching practices is much less straightforward for younger students. All these initiatives shows that the education community is having a difficult and an unpredictable moment. The COVID-19 is disproportionately affecting the poor, minorities, and a broad range of vulnerable populations due to its inequitable spread in areas of dense population and limited mitigation due to high prevalence of chronic conditions or poor access to high-quality public health and medical care. According to WHO, almost every country in the world experienced disruption to its medical services, with low and middle-income countries reporting the greatest difficulties. Most countries reported that many routine and elective services have been suspended, while critical care such as cancer screening, treatment, and HIV therapy has seen high-risk interruptions in low-income countries. COVID-19 should be a lesson to all countries that health is not an either-or equation. We must better prepare for emergencies, but also keep investigating in health systems that fully respond to people's needs throughout the life course. The COVID pandemic has led to a dramatic loss of human life worldwide and unprecedented challenges to public health, food systems, and world of work. The economic and social disruption caused by the pandemic is devastating. We have no time to waste. We need to take an immediate action and an effective response to this crisis. The UN, uniting with many partners, will launch a global collaboration to accelerate the development, production, and equitable access to new COVID-19 diagnostics, therapeutics, and vaccines. Together, we will create more robust systems for accountability, transparency, and integrity without a delay. Thank you.